The purpose of this video is to talk about the side effects of ADHD medication, or are they really the cause of the side effects? Recently, over the last 24 hours, had lots of comments by parents whose children are now back at school, or the last couple of days have been off their ADHD medication for some time, and now they're being put back on their medication. And they're often now saying there are lots of side effects. My child's got a runny nose, they're coughing, they've got a headache, they've got sore throats, their body's sore, or their tummy's upset, sore tummies, not eating, and emotional. And is this related to the side effects of the ADHD medication, or are in fact there other causes? ADHD medication is often blamed for a lot of different problems. And yes, when your child starts medication, they can certainly have problems with appetite suppression in the first couple of weeks of trialing their medication, emotional lability, volatility, lack of appetite, sometimes a bit of a headache, stomach ache, but those often go away. Now, if your child hasn't been on medication throughout the holiday and they're suddenly back on the medication, particularly if they go back onto a high dose and they haven't been on their medication, it can certainly cause problems. So just think about, is your child or has your child been consistently taking their medication? Are you giving it a break during the weekends and then suddenly back during the week? That can cause problems. The medication, like ADHD, does not cause problems with throat infections, runny nose, flu symptoms. I've had parents even worried about the hair falling out, looking at a few hairs on the pillow and worried about problems like that, or bad skin rashes. The only time I've ever seen a problem with a reaction or allergic reaction to ADHD medication, the stimulant medication, is a conjunctivitis, really red eyes. But that is not necessarily the case. It often happens in the early stages. The medications that we use are very safe. The non-stimulant medications as well, like Strattera or the INR generic, atomoxetine, if you suddenly stop the medicine, it won't necessarily cause a withdrawal symptom because it affects the noradrenaline. It doesn't cause necessarily a discontinuation syndrome. But if you suddenly restart it, it can cause problems. Tummy ache, lack of sleep, poor sleeping, and this is something that I've been seeing recently. So, the medication itself sometimes is blamed for a lot of different things. If you're not sure, let us know exactly some of those symptoms. Remember, it's winter, children are picking up lots of infections. They're going to be going back to school. They're going to be picking up colds and flu. You can't keep them in a bubble. We can't keep them in a bubble. They're going to pick up colds and flu. And that is not necessarily the reason that your child is sick because they're going back onto medication. So we've got to look at these things in perspective. The long-term side effects of ADHD medicine needs to be monitored. That's why I have recommended my patients come in at 3 to 4 monthly to check weight, height, head circumference, make sure there's a health check, make sure that their nutrition is right. There are lots of other reasons. Only today I was talking to parents where, the child's on medication, they've been consistently giving the medication throughout the holidays, but there are problems with sleeping. And when we investigated, this child's got allergies. Children are keeping themselves more indoors. They're in contact with their pets, indoors, allergies, winter, heaters, lots of indoor allergens, not going outside, not getting enough exercise outside. So they have sleeplessness, too much screen time. And in fact, this child has an allergy, has what we call the allergic fatigue syndrome, where the nose gets blocked up, they have difficulty breathing at night, wakefulness. This is not related to the medicine. So when we introduced a strategy of treating allergies, finding out what the problem is, that often goes away. Children who have allergies, sometimes only have developed them recently now that we're seeing children indoors in winter. So think about those kind of things. The type of allergies that we see in children are not necessarily related to the medication. There are some side effects with stimulant medication that are not really acceptable. A child who has chronic weight loss, who has appetite suppression, I often find with manipulation, changing the medication from short-acting to long-acting, sometimes non-stimulants helps the appetite and making sure a child eats well. You know, so many children are not eating before they take their medication. High protein diets. Protein equals neurotransmitters. Medicines that are taken with cereals or other types of breakfast, but together with protein, helps delay the release of those sugars in the diet in the morning, helps reduce those spikes of sugars that happen. You know, sugary foods don't cause ADHD, but they can aggravate the the personality of the child. The temperament, those spikes in sugar, irritability. And one of my patients was actually talking, he'd read an article, which is absolutely true, that the effect of sugar has almost the same stimulation impact that a drug like cocaine has. It's highly addictive. So be careful of those quick, immediate release sugars. Sleeplessness in children. You know, if a child's eyes are being exposed to screens, their melatonin levels are reduced, they've got their PlayStation in their rooms, they're on their phone at night, the last couple of weeks have been very anxious, they're worried, their minds are active, alert, they're not going to be able to switch off. And that's going to impact them the next day with their behavior. So think about, it's not necessarily the medication, give the medication as early as possible for ADHD so that it wears off before the child sleeps. Sometimes children need a little dose in the evening to help settle down their brains, believe it or not. Medication has a counterintuitive impact on sleep and helps children. Headaches, stomach aches. Often I find if children have the generic form of the short-acting medicine, it causes stomach problems. So just think about that. And having medicine that is too high a dose without eating, drinking, can cause headaches. And it unmasks tics or Tourette syndrome. Recently I saw a child who had a very unusual symptom of almost had a difficulty sort of breathing. And it was thought by the parents that this was a side effect of the medication. And when we investigated, it was due to anxiety, that extreme anxiety. The whole family was anxious. The child was having difficulty in breathing. And, you know, it makes such a difference if we talk about these symptoms, parents recognize their own anxiety and get help for those problems. Children look at us. They often take on a lot of our own anxiety. So we've got to holistically manage all of our own mental health. And then, of course, the emotional lability and difficulty with medicine. Giving the medicine at the right time, not allowing that rebound symptom to happen when the medicine wears off in the afternoon. Think about when it happens. Discuss it with us. That's why regular follow-up with consultations helps really dig deep and find out when these problems happen. Talk to your teacher. Are you seeing those problems at school or only in the afternoons? So this is very important to think about how medication aggravates things. I hope this helps.